Hello, welcome to the 17th webinar in the COVID-19 Ask the Experts webinar series, and the first webinar in our Return to School special series for NASP members only, addressing social emotional learning and mental and behavioral health. We want to thank you for being a NASP member, and we hope that you will enjoy these special skill-based webinars designed to help you take a deeper look at your professional practices. Today's webinar will address school reentry considerations for supporting student social emotional learning and mental and behavioral health amidst COVID-19. This webinar is going to provide an overview of the NASP ASCA guidance, describing how school psychologists can work with school counselors, school social workers, administrators, and other decision makers to ensure student social emotional learning and mental and behavioral health is prioritized as they prepare over the coming months to return to school in the fall, whether that be in person, online, or a combination of the two. I am Kelly Vaillancourt Strobach, NASP Director of Policy and Advocacy, and I will be your moderator for this webinar. I just want to briefly remind you that the Ask the Experts webinar series is a collection of recorded webinars, all of which are posted on the NASP website, and they're designed to offer support to school psychologists, interns, and practicum students as you navigate the delivery of school psychological services during the COVID-19 pandemic. Each of our foundational webinars are free and open to the public, and as I mentioned previously, this more in-depth skills-based webinar is part of a Return to School series that is explicitly for NASP members only. At the conclusion of each webinar, a discussion thread will be opened in the NASP member exchange as a follow-up, and any NASP member with questions or discussions that they would like to share can post your thoughts there, and I encourage you to do so to get some good feedback from your colleagues across the country. Each of these webinars addresses critical questions that are emerging as a result of the need to provide virtual telehealth school psychological services, provide you with advice and guidance from our experts, and offer suggested strategies for resources for addressing professional practice issues. So today, our expert panelists are three of the authors of the NASP ASCA considerations document. First, we have Dr. Christina Conolly. Christina is a nationally certified school psychologist and is currently the Director of Psychological Services in Montgomery County Public Schools in Maryland. In addition, she is the chairperson of the NASP School Safety and Crisis Response Committee and is a co-author of the NASP Prepare Crisis Prevention and Intervention Curriculum. We have Dr. Amanda Fitzgerald, who is currently the Director of Public Policy at the American School Counselor Association, and Dr. Eric Rossen, who is a nationally certified school psychologist, a licensed psychologist, a National Health Register Service psychologist, and he is the NASP Director of Professional Development and Standards. Thanks to all of you for being here today and sharing your expertise with us. So I will now turn it over to Amanda, who will kick things off for us.
Thank you, Kelly. Thank you to the National Association of School Psychologists for hosting this webinar today. The American School Counselor Association with NASP have worked together as partners for a long time on many important issues, many federal policy issues, and it made sense to come together for this document. Currently, the world is busy tackling various challenges related to the pandemic. There are issues of equity and access to devices, technology, access to Wi-Fi, access to school lunch, issues related to professional development and ethics moving to an online classroom, and how to address the academic slide or regression that the entire country is seeing. We determined it was necessary to have a standalone document to address the many considerations that surround the social and emotional learning needs and mental and behavioral health needs of our students. We've already shared this document with many stakeholders and will advocate that student mental health should be at the forefront when schools open their doors. There will be significant needs, and school and district leaders should be preparing now to meet those needs when students return to school later this summer or the fall or whenever we get back to learning. So ASCA is very pleased to join with NASP to introduce this document, to push it out, and hopefully have schools and district leaders use it to prepare for schools as soon as they're open. This document's just another example of how school counselors and school psychologists already are collaborating in the building every single day, and we'd like to model that also on the national level. So we're just really grateful to collaborate and be able to not only introduce this document now, but also revise and edit as we go along during the pandemic. I'm going to turn it over to Christina now, who's going to touch on multidisciplinary teaming.
Thank you, Amanda. And so as we're going through and talking about the recovery, it is so key that whether you're working in your building, whether you're working at the district level, that there should be a multidisciplinary team that is working together in order to start to plan out what the recovery looks like. And so the team, it should include, administration, whether building administration, district level administration, of course, school-based, school-employed mental health professionals, school psychologists, counselors, social workers, and also we need representation from your teachers, nurses that are going to help with many of the public health issues that are going to come about in terms of recovery, in terms of where you got to have hand sanitizer, masks, like social distancing, talking about all those medical things that are involved. And the public health officials are going to help with that part. But then also there are many district and community stakeholders that need to be involved as well. So of course our parents who have a say, and many of you may have seen things, a lot of parents have a lot of comments online in terms of what should be done in your schools. Involve them, because they want to make sure that their kids are safe, and they won't send their kids back to school until they feel like the plan in place is a safe one that will so their children will come go to school. But then also, especially if you work in a state or an area that has a union, they're going to be key in terms of helping you to go through this. So I cannot stress enough the collaboration that is needed when going through this process. And so once that team is formed, they have certain responsibilities in terms of reviewing your local, state, and federal guidance on the recovery process. There may be documents that have been created. I know in Maryland, we have a draft document from MSDE that's telling us, kind of giving feedback in terms of what you should do. So you need to go look for those things that are out there. And then also, how are you going to coordinate your response with other public health entities or other entities that are out there in the community, because you're all working on recovery. And what does that look like as you're working together to move forward with this? And then also that communication of what's going to happen when you re-enter. What's going to happen with short and long-term recovery in terms of what happens immediately when you come back to school, let's say within the first month. And then after looking at that long-term recovery, what are the things that you're going to do? You have to communicate this with your key stakeholders all throughout. And even if it's that we are working on the process, we don't have anything to share at this time, but we just want you to know that we are working together on this, and we will put out information once it's available. Parents are wondering and asking. I'm hearing stories of parents asking their teachers, do you know what's going on? Because people want to know what's going to happen with the start of the year. And don't think that because it's summer that they're going to wait until August to ask you. No, they're asking now. So making sure you're communicating throughout this. Also, where are your resources that are available? Do you know where all the mental health resources are available within your area? And so you can do what's called resource mapping, where you can look at okay, we have these agencies, but where are they placed? So in my county, and my county is huge in Maryland, and that we know that there are pockets in the region that have no mental health services. So we have to map out where they are in order to see well, this community needs more of this from the school district because they're lacking in community help. So looking at where they are and what resources are available in each area can help you to see the gaps that can help in your recovery planning. And then also when you're working, you may be working with, let's say you have a mental health side is working on one thing and curriculum is working on another, and you got transportation and building maintenance and all these people working on things. But you have to make sure looking at your common goals, because you don't want to be creating a message that's going out into community and then another group is creating the exact same message because you're working in a silo and you're not working together. So what can you do to make sure you're all working together with your common goals, and what can you do to help you in terms of not avoiding duplication, not doing the same thing? Because you could spend a month on something, you find out someone else did it, you're all going to be very mad. So working together, breaking down those silos is key as you're going forward with this. Okay, now I'm going to turn it back over to Amanda.
Great, thank you. The document also goes into great depth in addressing the social emotional learning and mental health needs of students and staff. It's important to anticipate that everyone's going to have some sort of regression when it comes to our social skills and our social emotional learning when they return to the building. So we want to build off the unique experiences they've had. We want to develop different strategies to be able to talk to these students and conduct lessons during different phases of recovery. Most importantly, we want to make sure we're embedding social and emotional learning throughout all facets of the school day, especially the core curriculum classes. So if we have to abruptly go back to a virtual learning environment, or if we have hybrid schooling, that the social emotional piece isn't what's getting lost because we're just focusing our energy on math and English language arts. So we're going to recommend we do that through tiered systems of support. Again, the services and the systems are tiered. We're not actually tiering students. So we want to look at what are the services we do throughout all students. What services are being covered there. This is a good time to examine your capacity for screening. We know that not everybody has the capacity to screen, and it is very important that if you are going to do universal screening, that you have the supports in place to provide intervention services. However, beyond screening, there's a lot of informal check-ins. There's surveys that can be conducted throughout all of our families and all of our students to be able to get some of that baseline data. There's also evidence-based curriculum, morning meetings, advisory periods, peer buddies. These are services that all students can benefit from, not just students that might have more intensive needs. Those students that do have the intensive needs, we could provide individual and small group counseling. We certainly want to consult and collaborate with our community providers and all the teachers, staff, and other faculty in the building. And then for those students that identify that need more intensive services, we want to ensure that we are consulting and collaborating with the appropriate people to be able to provide those services and be able to provide the wraparound services and referrals as needed. So again, we want to just remind you that there's evidence-based resources and standards out there. You don't need to recreate the wheel. Just two examples I've shown up here. One is the ASCA Mindsets and Behaviors, which are school counseling standards. These can be explicitly taught in classroom settings. They can be embedded with your core curriculum. They can be crosswalked with other SEL lessons you're using. They can also be used as standalone for small group curriculum. And then the other tool here, both linked in the handouts, will be just a very basic planning template that gets you in the mindset of thinking in tiered systems. So what services are we going to provide to all students, some students, few students, but also thinking about our different groups. So not just students, but our families are going to need different services, our educators are going to need different supports, and then thinking about planning in a very continuous process. So not just right now, but probably weekly until we know exactly what the school year is going to look like and exactly how the situation's evolving throughout the whole entire school year.
Okay, thanks, Amanda. So in thinking about the relationships that, or reestablishing relationships, thinking about that transition process, and many times we have a lot of materials and a lot of thought goes into the idea of back to school. You may get messages as families and your school is sending a lot of back to school transition planning. Well, this year is going to be particularly unique and challenging when transitioning back to school after summer is already challenging on its own. First, we want to recognize that the challenge of transition will vary substantially based on, individual experiences, individual appraisal, lots of unique individual characteristics, and that's the case for any stressor and that adaptive response to it. It will vary by individual. So we don't want to make assumptions that everyone will have a similar trajectory or response to that transition period. But we want to be particularly mindful of the challenges presented to those that are changing schools, whether it's because they've moved, they've perhaps boundaries have changed in certain schools, those that are entering kindergarten, those that are entering middle school, those that are entering high school. We want to be mindful of the fact that there was a lack of closure of relationships from the previous year. Even though there may have been some very well done end of year closing ceremonies and parades and virtual meetups, It may not feel the same, and some students and staff may actually feel that some of the strong relationships and the experiences they're used to having to say goodbye and part ways really, they didn't get closure on that. And so thinking about ways that you can possibly allow students and staff to reconnect with those that they didn't have closure with last year. I know there are some schools that are attempting to keep classes together for the next year if they're not staying with the same teacher. We identify looping here, and this, some schools are doing this. It's this concept where the teachers actually follow the students too, to allow for that continuity, familiar face, especially when we're in a situation that may be unpredictable for many months into the school year. This is usually done in elementary school settings. The logistics are very challenging, and the logistics are even more challenging at middle and high school levels. So there's a lot of logistical considerations that need to be made within the unique context. But again, there is some evidence to support looping when it can be done effectively, and again, usually done at the elementary school level. In this case, maybe indicated or something like it, where students are maybe together, even if it's just for the first couple weeks, where they can reconnect with each other. We want to be mindful that we're going to need to teach and reteach expectations and routines. This is something we probably would want to do anyway in a typical school year when we're coming back, but it's been many months. Many people have gotten into different kind of habits and routines that maybe do not align with what the expectations and routines are at school. And so we want to potentially refrain from introducing lots of new academic content until those routines are firmly reestablished, and think about a gradual reintroduction of academic rigor over time, maybe at a slower pace than what was done in the past. And then we want to anticipate a high likelihood of exhaustion, fatigue, and sleepiness. Right? People aren't having to set their alarms and commute and wake up as early as they used to. And suddenly there's going to be this cosmic shift in people having to wake up early, eat breakfast by this time and pack your lunch and out the door and get to the bus stop. That's not just students, that's staff too, right? Everybody has totally shifted their kind of internal clocks, and that's going to be a really tough transition. Again, it's usually tough after summer, but it will be half a year at least at that point. So helping students reconnect, thinking about back to school events, and again, this is something that most schools are already doing something like that. So in this particular case, whether it's virtual, whether you're having some version where people are together or in some shared physical space, you want to be purposeful more so than ever to allow a place for families and students to meet with the school-employed mental health professionals and the mental health staff that may have any questions or concerns. Give an opportunity for the mental health staff to share input, provide details, give certain facts, talk about, validating emotions of students and the fact that many may, there's lots of different responses that students may have, and that's okay. Virtual tours might actually be a particularly useful thing for those attending a new school. If they can't do an in-person kind of walkthrough, maybe someone can do a virtual walkthrough of the school. Here's what the cafeteria looks like. Here's the 6th grade lockers and their corridor. Whatever, if they haven't had a chance to really tour a school. And again, that's particularly useful for those that have not been to that school in the past and may not know what it looks like from the inside. Having a mental picture of what something looks like ahead of time can potentially reduce some stress and anxiety. Consider ways to celebrate staff that have retired that aren't coming back. And again, I know a few staff that that are school staff that are friends of mine, and they have this feeling of this very unceremonious ending to a very long career with relationships that have been going on for decades, and they kind of just got like a Zoom meeting like wave. So is there a way to kind of bring them back? And this is all part of that, like reconnecting with people, reestablishing that sense of community that's so important in a school. Consider matching peer buddies. Peer buddies can be, I would say, it can be the same age, or it can be older and younger students, and you might want to think about this for students that may be at risk for a challenging transition based on whatever information you may have. If you have a way for some kind of initial triage and assessing risk. If you match older and younger students, that can be actually very beneficial for both, right? Older students, the ability to help others can really mitigate impact and assist adaptive recovery. And then, again, just in this mindset of having those relationships reestablished, having an opportunity for people to check in and reconnect with their community, the idea of year-long homerooms or advisory periods or transition periods at the beginning of every day. Many schools already do this, but if you're not, it's something worth considering. And again, that could possibly be trying to match students with many of their peers from the previous year as possible. So we want to be mindful of the potential for trauma or the increased risk of a range of stressors or adversities. So there's lots of evidence related to the increase in domestic abuse, child maltreatment, exploitation that's occurring during COVID-19. Also for students with disabilities, so parents may be more stressed, social services are limited, and all the adults that are typically making reports and providing supports to these students, if it's not their families, are inaccessible, or they're not seeing it and they're not making those reports. By the end of March, the National Sexual Abuse Hotline had 22% more calls, and half of all incoming calls were from minors. And that was just in March. And that was just at the very beginning of many of these school closures. I know with family separation, for example, some were away on business, for example, and then couldn't return. And so there are many families who have been separated, or at least were separated for some time and not being able to see loved ones. Some were not able to process grief and loss. I know I had a very good friend whose father passed away, and they could not attend. They had to do a Zoom funeral. And he still has not been able to actually spend time with immediate family members and grieve together because there was concern about, putting everyone at risk. So we may want to consider if and how we are identifying these folks. So we may be able to at least review the data we have and identify those we know at least maybe at increased risk for some of these. So NASP put out, and this is in the COVID-19 Resources Center, a Countering Coronavirus Stigma and Racism. This was actually put out pretty soon after school closures started in March, and it was in response to the introduction of rhetoric related to COVID associated with China. There was a China disease or China virus, and that there have been stories of individuals of Chinese and Asian descent experiencing racism associated with the pandemic. There was incidents of African American students targeted for wearing masks in public. So there's other sources of stigma that may include those that became sick or tested positive for COVID-19, those that had family members that became sick, those with respiratory illnesses, or maybe those with allergies that are sneezing a lot or coughing a lot. Are people going to want to stay away from them or view them or judge them negatively? There might be some stigma around the kind of masks kids are wearing, or whether they can afford the N95s versus something their mom stitched up for them. So we want to be mindful of stigma associated with this and all the potential sources of that. And address it by sharing accurate information, countering microaggressions, watching and stopping harassment when it occurs. So then identifying those at higher risk. So again, this might be through a referral system of some kind or an initial process of psychological triage. But we know that ongoing exposure to chronic stress and multiple doses of stress can be really toxic on young developing brains. Now, it's possible that some students may actually have had positive experiences during this shelter-in-place time, or that the return will actually be better for them, right? So, for example, you may have some students who experience frequent bullying during school. And when we went to remote learning, that bullying stopped, and they actually, some of that anxiety decreased. And when they go back, and if it's some hybrid model, they may like it better than how school was in the past. So, we want to take the information we have and try, if it's possible, to think about, was there a history of adversity or stress that puts students at higher risk, and then will the transition put, add certain additional risks to students, and if there's a way to kind of triage and think about risk in that way, as a way to just identify resource allocation, that could be a helpful process. I'll turn it back over to Christina.
Okay. So next we're going to talk about how to address physical and psychological safety in the schools. And so in looking at some of the strategies that are there, remember in the prepare model we talk about needing to balance both the physical and psychological safety, and both are important. And when we're thinking about the physical safety piece, when it comes to recovery, it may look differently than what it has done in terms of, like, during the training we talk about like natural access control and student supervision and so forth, and concepts of septet. But now we got to look at these health considerations that would fall in with the physical safety pieces. And so some of those things is looking at what are the social distancing and sanitation or hygiene considerations that you're going to put in place. I've seen people talking about, like, well, what are you going to do about the buses? And so how many students can sit on the bus? Do you need like partitions between the seats? And so forth, and how to do this. So, I mean, I've heard some things like you might have a bus that fits 40 students and only 20 students can be on there now because of social distancing guidelines. And what does that play in terms of coming back to school? How are you going to work in the classroom so that they are socially distanced? So you may not have, like elementary schools a lot of times, or middle schools have pods, where kids sit together in groups so they can do group work together. And now they're saying you need to be in like the traditional rows that face the front Promethean or Blackboard or whatever. And so how are you going to, and keeping students maybe like 2 chairs apart, so only like half the students in the class can be there. So in many schools are trying to figure out what does that look like, which is why they're thinking about, like, do you need like an A-B schedule, like half the kids come one week and then the B kids come the next week and so forth. What are you going to do about masks? What are you going to do around hand sanitizer and hand washing and those types of things? And then also, but for us within, our school employed mental health professionals, are you going to have enough space to conduct confidential sessions while also maintaining social distancing? And this includes with testing. So I've seen people who have come up with like plexiglass and desks in order to maintain social distancing within each other. But then also, like, I remember like when I worked in a school and I literally did testing in the closet. So that's not going to be socially distant. So you need to make sure you're in a room that's big enough so that you can be socially distant with each other. Let's say if you're doing like counseling services. So what are you doing around that? And then also working with, let's say, like your communications or your PR departments to look at developing videos of school leaders and other people showing what kids need to do. So in terms of not just saying these are things you need to do, developing videos that show people need to do. And then you can post them on your website, post it on social media in order to make sure you're overly communicating what steps need to take in order to do these things. And then also, what are the expectations on using masks and the sanitation procedures, making sure people understand that. You can include those in those videos that show what to do. And then also, what about for the students or staff who can't wear the mask due to medical issues? What are you going to do for them? And so this all needs to be a part of your plan in terms of thinking, which is why you need your nurses and your public health officials there to help you to look at these strategies in terms of things, specific things that you're going to do to help all students and all staff in your schools. Right. Some additional strategies may include, so let's say if you have wellness rooms or if you have like mindfulness rooms, what are you going to do for students who need those spaces, especially coming back, and they need those spaces in order to help them to recenter themselves? What are you going to do around maintaining sanitation rules around that? So are you going to have one student per room, or are you going to have the staff members who are monitoring those students to stay, like 6 feet away from them? Are you going to use like wipes or Lysol in order to spray, in order to clean. So let's say they're sitting on a beanbag, or you have to clean off that beanbag for each student that comes in. What are your procedures around this? Because those rooms are good. Students need them, but you got to think of the sanitation procedures around that as well. And if you don't have those rooms, I highly recommend getting them. And so we have several rooms like that in my county. The students love them. It allows them to have a safe place to be able to go if they're upset, calm down, and being able to come back. And is definitely an alternative to discipline, and especially looking at disproportionality rates. So having those is great. And then also, what are your strategies for working with families or students who have these health considerations, in terms of, let's say if you have a student or a staff member who has cancer and they're immune compromised? What are your procedures around whether if their doctors say they can't come back to the building, and they need to continue with distance learning or teleworking? And then also, what happens if you have students who have a lack of medical care, and all of a sudden they're coming to the nurse, they're going down to the health suite in order to get some of the care that they haven't gotten this whole time while schools have been closed. And so you may see these increases. And so how is a nurse going to manage having a long line of students waiting for them? Are you, in terms of coming in to see them, because you can't have a whole bunch of people in there because of social distancing guidelines. So thinking preventatively in terms of what are some of those things you're going to put in place. And then also going back to the attendance and other guidelines related to illness and exposure. If you have somebody who contracts COVID-19 during this time, or their family has their family has somebody who has COVID-19, what are your procedures around that in terms of them being able to continue with distance learning? Or how long does the staff member have to be out? You have folks who are concerned about, especially if they're paid hourly, concerns around if they don't work, they don't get paid. So are they going to have paid sick leave during this time? And so you're going to have to work with district administrators and the budget office in terms of looking at money that can come from like the CARES Act that can help to support this. All right.
So regarding discipline, I think initially we want to acknowledge that most students are, they have inconsistent behavior and academic expectations from the previous several months, and then the expectations at home are going to be different than what the expectations are at school. So again, with a pretty significant period of time outside of school, our expectations and appropriate behavior expectations should be explicitly and regularly retaught. So we shouldn't go in thinking that, students, if they were here last year, they're going to remember exactly what our expectations are. We should be regularly reteaching that and avoid going right to punitive and exclusionary discipline like suspension and expulsion. No, some teachers, in an effort to add structure and predictability to the classroom, they may want to use class-wide clip charts and colored behavior cards as a behavior management tool. But any kind of public punishment system can do more harm than good, particularly for students with disabilities or those experiencing significant stress or trauma as a result of this. So instead, focus on practicing and acknowledging expected behaviors with the understanding that some students may need more teaching, more practice, or more acknowledgement to use those strategies than in the past. We want to view things through a trauma-informed lens. So in part, that requires us to see or acknowledge that certain behaviors may be an adaptive response to their environment and their context and their experiences and the appraisal of those experiences, as well as a potential skill deficit that requires intervention rather than seeing everything as an act of willful disobedience that requires some kind of punishment. And then secondly, we need to remember that many times, even if those behaviors feel like they're directed at us as adults, it's not, right? It affects us, but it's not about us. It affects me, but it's not about me. They're not giving me a hard time, they're having a hard time, even if it feels like it's directed at us. And then finally, it's possible to anticipate that there might be a prolonged honeymoon period at reentry, right? There might be a lot of excitement about coming back, reestablishing those relationships, a change of scenery, getting out of the house. A lot of times schools see a honeymoon period to begin with. At the beginning, the first couple of weeks of school, it's a little, sometimes can be smoother. And so we might anticipate a more prolonged honeymoon period, but then potentially an increase in student defiance or resistance, particularly as academic demands start to ramp up. And that might be a method of establishing control, right? Many students may feel disempowered from this whole process. Some might feel victimized. Some might feel abandoned or resentful, just at the world and the community not being able to do the things that they expected, or not directed at any individual per se. Others may have lost trust or faith in the school's ability to care for and protect them. They might have experienced emotional numbing. So just take extra time for that relationship building and try to be very mindful of avoiding a process where any misstep is treated with some kind of exclusionary punishment. Along those lines, there's two resources on the NASP website. This first one on the left is research summary. That's from 2018, and that really outlines all or a range of available research to support any local level advocacy. Shares lots of information about what works and what doesn't work regarding discipline and school-wide policies. Now, I'm also happy to share that just in June 2020, we released the framework for effective school discipline, so it's hot off the press, and really outlines, as it says, a framework for schools and all the different things that schools should think about when it comes to effective school-wide discipline policies. So I highly recommend checking that out. Particularly right now, many of those components apply.
Thanks, Eric. So next we're going to talk about staff needs, and we always have to remember that we cannot forget the staff members because who are the people that are there supporting the children? And they have been impacted by this pandemic just like our kids. And so they're going to come back and they may have had their own stresses during the pandemic or losses in family due to people potentially being sick or dying from the illness. What about staff who are hourly who may have lost wages during this time? And so we just have to keep in mind that what has staff members experienced during this as well. And then also there's been a lot of talk from community members, from families around what the schools have or have not done. And staff members have been watching this. And so they may have their own traumatic experiences just from seeing many of the negative comments that have come about on social media saying, well, the schools didn't do enough. These teachers suck because of distance learning. My kid didn't learn anything. All they did was review for a month. So just keep that in mind because that can have a negative emotional impact on our staff as well, especially when they come back and they have to reconnect with families again. So keeping that in mind. And then also for those who weren't able to say goodbye to students or staff who maybe weren't returning. I know I have 2 staff members that are retiring. Normally you have these big retirement parties and you do all these things. None of that has happened. And so the typical things that we do for transition didn't occur for the staff. And so they may have feelings of loss because maybe their partner teacher or somebody they work closely with is gone now. They've gone on to another building. They retired. They resigned. And we didn't get a chance to have the normal goodbye transition activities that schools normally do. Just like the students, I have a 5th grader who's transitioning to middle school next year. She did not have a promotion ceremony, and her and her friends are very upset about that. The staff have their own transition things that they need as well. So we have to keep that in mind. And then here's some strategies for how to support our staff members. So for those who have experienced their own loss or stress, what are the systems that we're going to put in place for supporting all staff? We know that many school districts have in place like employee assistance programs or EAPs, which rely on staff members to self-refer. So what are the things that we're going to put in place that support all the staff without a reliance of, oh, if you need help, you'll go get it? Many staff members won't. So Do we have things that look like a system called tap in, tap out? This is where staff members, if you're feeling upset, you need a break, you can then text another staff member in the building who's available at that time. They can come in and cover your class for a moment to give you a chance to, kind of de-stress a little bit. Just like we have the mindfulness rooms for our students, staff members sometimes need that as well. So what are we going to do in order to provide that support? What are we going to do to help them in terms of boundary setting? Because maybe all of a sudden they feel like, well, all these kids are coming in, they have all this stuff, and I got to do all this work, and, I'm the only person that can help them. Like, no, that's not. We need to put in place procedures that help to care for the caregivers. So what are we going to do to help them during this time? Set those boundaries in terms of what you cannot do to support them. And then also, what are the other community resources or any EAP support that's there? Are we doing a good job in terms of overly communicating to the staff about the resources that are available, how to connect, let's say if they have health insurance, which providers work with which health insurance companies? Because sometimes you may like, oh, somebody tells you this is great therapist, but then it doesn't connect with their insurance. So what are we doing to make sure we guide them through that process? Because they may be stressed out enough, then all of a sudden they see all these things that they got to put in place in order to do it, and that may stress them more. So what can we do to make the process as simple as possible to help them to know how to get this help? And then also, many EAP services provide like a number of free therapy sessions for staff. So in my school district, I believe it's like 3. So people can go in and get some initial therapy for free, so they don't have to worry about the financial burden of paying for that at that time. So it's just good to know all those services that are available, because we do this for the students. Like, that's like a natural thing, but a lot of times we forget about the staff, but we cannot forget to care for the caregivers. That also includes ourselves as school employed mental health professionals. We got to take care of us because we're always being called to take care of others. So when we look at all these things, think about you as well, because you need it. All of us need it because we're in now those caregiving roles.
Thanks, Christina. I just want to touch on family engagement. Family engagement is always important. It'll be especially important now. As Christina discussed at the earlier on, that we should include that family voice in the multidisciplinary team process, where they have an active voice in what their needs are and expressing their concerns, and part of the planning phases of what is to come. We want to engage families frequently. So I know there's a lot of uncertainty about what school will look like in the fall, and there are many schools that are sort of holding back that parent communication because they don't want to express their uncertainty. However, I think that's a mistake. I think we should be engaging with them frequently, telling them we are unsure of what's going on, but what we are sure of is that this is our school community, and trying to build that school community with our families. That'll also help us give us an idea of the communities we serve. So this is especially important for those transitioning grades, your incoming kindergartners, your incoming middle schoolers, your incoming high schoolers. We want them to be part of the school community no matter what. We don't want the year of COVID to deter from their experience as an incoming 7th grader or a graduating senior. We want to, you can host coffees or brunches or evening activities to try and engage parents at many different times. We're going to have also, we need to look at parents as a partner in this work always, but especially in times of virtual learning. We know a lot of them had to step in to provide services to our students when we couldn't be there, but also help them with their academic progress as the pandemic went on during virtual learning. It's really helpful to know how many of your families have essential workers, what the home situation is like for these students. We can also use this as an opportunity to identify the needs of their families, those that might be experiencing food insecurity or needing other shelter or basic needs, that we can link them up with the resources. So again, I would just encourage often communication and engaging the families, not just talking at them and throwing emails out, but providing that source of communication to where you can have a dialogue and some sort of open meetings for everybody to chat and get to know each other. Also, we never want to forget a big plug for our access to school mental health professionals. So we know that budgets are going to be cut next year. There are many states that are working at a deficit right now. We know that schools are funded because of taxes, and many businesses have gone under. We are waiting for federal bailouts, and so we know that there will be tough decisions being made. So we're using this document and our knowledge that students are going to have a wealth of mental health needs going into the next school year to keep ratios and staffing at the current levels, but really to aspire to increase those numbers to national recommendations. There are many schools out there that do not have a school nurse, and we are talking about sending millions of students back during a pandemic without a school nurse. So some of these are just non-negotiable. So our recommended ratios: school psychologists 1 to 500, counselors and social workers 1 to 250 students, and school nurses ask for a ratio of 1 to 750 with a healthy population. So we know that the nurse ratio has got to be addressed. We also really want to aspire to get to these levels so that the students have the supports as we go back.
Okay, and so then next we want to talk about, so as we are doing this planning, so we know that the pandemic is evolving. You may be hearing things on the news about rates going up in certain areas of the country and around the world again. And so we have to come at this with the mindset of, and especially when talking with our parents and other stakeholders in the community, that what we're planning here, and we have to adjust for that change. And that it may come where all of a sudden maybe we send kids back to school in a hybrid model, but then all of a sudden the rates go back up again, and then they have to come back home and go back to distance learning. That is a part of this pandemic, and that we have to use the data in order to help us to make these decisions. And that and sometimes that's frustrating for our families because they want to know now. Like I'm hearing a lot of, I need to know now. They don't know what they're doing because they don't have a decision on what's going to happen in August. I'm like, but it's June, it's July. We may not know until August, but we're going to have to look at those rates then in order to make decisions, real-time decisions based upon what's going on. But then also, what have we learned during this time? And so school districts had to quickly basically adjust K-12 education, or pre-K-12 education, that is a model where kids come into a building and learn, to a distance learning model basically within 2 weeks. And so during this time, what have we learned? What are some of the things that worked? What are some of the things that we didn't? And then how can we grow and evolve based upon this information that we have? But then also, especially as we're going into the new year, teachers and students are going to have to get to know new classmates, new teachers. Building relationships is going to be key. And teachers and staff members should spend a lot of time on that when we first get back to school. But then also, but how do they do that? So do they need professional development in order to help them to learn how to manage these things? So one of the things we're planning, like we're looking at training for our staff in terms of how to manage students' emotions during this time, how to use trauma-informed practices when building out their classrooms, how to look for red flags in terms of what are the things that show that students need support. And teachers need training on this. And so we just can't come in with the expectations that they're just automatically going to know what to do. So spending time this summer looking at that. What are the community resources that are available to help families who may have changed or may have struggles during this time, and having those resources available. And again, I cannot communicate enough that we need to have lots and lots of communication with families in different ways than maybe than what you're used to. Because if you're like, well, we don't typically have a lot of parent engagement, we communicate, then maybe we need to adjust how we communicate in order to, what are the ways that families look at, where are the places that they go to get their information, and maybe we need to start looking at those places in order to share so that they can share the information instead of us doing the same old thing we've been doing all the time and then expecting parents to change. Maybe we need to be that change. And so, and then also this constant communication helps to demonstrate that there's transparency, that they can know what you're doing in real time, so that it's not that you're trying to hide something or that you're not working on it. So because parents, there's a lot of distrust about what's going on. Parents are scared. And so with that fear comes a lot of, it goes like, it gets directed to staff, it gets directed to the schools, it gets directed to the community. But when you look at the foundation of it, is fear around the pandemic and what's going on. So, and how can we support families through this? How can we communicate to them what is going on, especially when things change? Because all of a sudden it could be, well, wait a minute, you said they're going back to this hybrid model and now you're saying they got to go back to distance learning. I'm supposed to go back to work. These people don't know what they're doing. That's not the case. The information, the data changes, rates may change, especially as people start going back out, going to the mall, going to the beaches, to amusement parks, so forth. Then all of a sudden rates may go up because more people are catching illness, even though rates were initially going down. And then public health agencies have to adjust. So we just have to make sure we're constantly communicating, constantly letting them know the resources that are out there to help them, and providing support for families during this time. We can't stress that enough.
Thank you guys so much for all of this really fantastic information. There are a couple of key messages that really stand out, and one is that it's clear that when we return to school, our focus really should be on social emotional skill building, looking at mental and behavioral health skills, self-regulatory skills, social skills, all of which likely has regressed during this time that we have been away from school and away from the typical social interaction that our kids and staff are used to. And I think, again, another thing that really, a point that I want to reiterate is that we really need to make sure that we are avoid that assuming misbehavior or lack of demonstration of social skills represents willful disobedience. We really do need to make sure that academic learning takes a back seat to kind of reteaching some of these social emotional learning skills, knowing that our kids got varying levels of support and instruction over the summer. So we have just a few minutes, and I have a couple of questions. And one question, and I think, Christina, I'm going to start with you, is you had talked a little bit about the importance of identifying students who are going to be in need of additional support, screening for risk and identifying trauma, knowing that there's a very real possibility that schools are going to be either in a hybrid model or in a virtual setting where we won't be having some of those in-person interactions with students where we're generally able to identify those kids who are at risk. What suggestions do you have for psychologists and counselors and schools in general for helping to identify students who are going to need additional support if we're not back in the school building?
Right, and thank you. So when we're looking at this, and we're having these conversations now in my school district, so how are we going to find the students who are in need? And so we look at, so within the Prepare curriculum, we look at how to triage, like looking for certain variables that students may be exhibiting behavior. So such as, do we know of staff or students who either themselves or their family were exposed to the COVID-19 virus? And so looking for those and say, okay, we're pulling them saying these are some kids who were physically proximate to what's going on in the pandemic, and they are having concerns around that. What about the areas around social justice that's going on in terms of like the Black Lives Matter, maybe individuals who have been impacted by that? And so do they in particular need additional support because maybe they were out protesting, or maybe their family member was impacted and maybe they've experienced police violence or other things that are going on, and they have an immediate impact because they have been directly impacted by something. And then also, what about kids who have experienced child abuse during this time? Rates of child abuse have gone up. We have to have that same worry around students who have witnessed domestic violence, or staff members who may have experienced domestic violence. And so those are other kinds of like vulnerability factors, and also those who maybe have past experience, traumatic experiences that they've gone through. So those who we know and that we're working with the teachers, maybe we're developing referral systems, like I'm developing a Google form so that schools can use, that teachers can fill out in order if they know of a kid who they think is in need of help. Because when we come back to school, we can't think of it as, oh my goodness, I'm going to call the crisis team to come to my school. And that's not going to happen, because all schools will be impacted by this. So what are the things that we're going to put in place for all kids, like looking at all tier 1. So that's why we're looking at the SEL lessons. In my district, we're looking at using the psycho-ed lesson model in order to go in and talk with all classes in order to give them information about normal coping strategies, stress management, and if they need help, where can they go to get help immediately. So we're just taking it all because everyone has experienced a pandemic. So we're instead of what we normally look at that as like a tier 2 support, in our district, we're looking at it as a tier 1 support. So everybody's going to get a little bit of something. Then for those who need more, then at tier 2, then we're going to make referrals for individual and group crisis intervention supports. And then as we get into the long-term recovery, those SEL models are going to be so important. If you have the amount of folks to talk about screening, and so in looking at that, because again, initially, you're going to have a lot of people who are really upset. You may not want to do screening then. But screening in the long term, you know, in terms of the promotion for SEL screenings are important because it's going to help you to find those kids, you know, behaviors on a continuum. You know, those kids who act out and will yell and curse and so forth. What about those kids who are withdrawn, who are quiet, who may be depressed or anxious, they're getting good grades, and you have no idea that they're there? You need a way to find them, and screenings can help you to do that. So in the long term, that's a good tool in order to help you to find those students. Because it's hard. There isn't a perfect system out there that's going to help you to find everyone. That's why you need the collaboration of your staff. You need to make sure parents and families are aware if you have a child who's in need of help to let us know, so that we can get help for them in communicating out to the community what you're doing. And that's going to help you to find as many kids as possible. So those are some of the things we're doing and putting in place in my school district.
Yeah, and I'll just jump in. You know, I think everything that Christina said is spot on. I think it's to some degree we are having to shift our understanding of a multi-tiered system of support here. You know, how we think about the services students receive in different tiers is not just based on the severity or intensity of the problem, but the breadth of the problem among the student body. So if normally we would say, oh, that seems more like a need for a tier 2 or tier 3, but 80% of the students are experiencing it, we're not going to put 80% of students in the counseling group, right? That indicates a tier 1 range of supports and services like Christina was talking about.
Great, thank you. And so I think it's clear that school psychologists and school counselors are going to need to collaborate with our school social workers and nurses and administrators. Amanda, you know, as you mentioned, this particular document is just one other example of school counselors and school psychologists collaborating together to promote good outcomes for kids. What recommendations would you have for how school psychologists and school counselors can continue this collaboration over the summer and moving into the new school year, recognizing that we're not having those typical summer planning meetings that we normally might have. We're going to be doing everything virtual, but what advice would you have to school psychologists and counselors to make sure that this collaboration happens and to make sure that we are at the table as schools make their reentry plans?
Yeah, thanks, Kelly. I think it's going to be crucial that school counselors, school psychologists, and school social workers and folks that can lend their expertise to mental and behavioral health are at the table so that they can start. I think we're hearing a good amount of conversation from school leaders, principals, and administrators that know mental health will be a topic that they cannot ignore and just return back to normal, quote unquote, normal learning. So I do think that there's more of an understanding, more so now in 2020 after the events of this summer, not only COVID. Christina's absolutely right. This is when this document was published, it was before the murder of George Floyd. And so this isn't just the summer of COVID anymore. This is the summer the country really took action late, but they did it. And so I think that will be another topic that needs to be addressed intentionally as we talk about reintegration into the schools. So I think the needs are going to be there more than ever. I think doing this on a virtual level will be we'll have to do it on a virtual level. And like I mentioned early on, and like Christina talked about with the multidisciplinary teams, I think this is the time resource mapping comes in, where we can start divvying up what resources we already have in place, how we expand upon those resources, being able to do a needs assessment about what resources we need, looking at staffing in all of the buildings. So if our school psychologists are split amongst buildings, but we have one FTE school counselor or 1.5 and a school social worker, really making sure we're intentional about how we're contacting students, being able to do some informal surveys or reaches to be able to gather that information, to talk about how we are implementing the services. So yeah, I think that the planning, and more planning is going to be very important before the first day of school, whatever that first day looks like where you live. And I think that the more out in front we can get, and the more intentional we can get about it, will be the more we'll have the better results and more effective planning for our students.
Great. Thank you guys so much for all of this great information. I just want to remind everyone that we do have a wealth of resources available to you. So as with every webinar, we've included some direct links to the NASP COVID-19 Resource Center and some other resources that will help you as you are planning for your return to the school year. I encourage you to review and share this NASP ASCA considerations document with those that you are working with in your schools to make sure that we are prioritizing social emotional learning as we do school reentry. And we've also shared some external resources, including the ASCA mindsets and behaviors that Amanda mentioned earlier. You'll be able to click directly on this webinar you can download the PowerPoint and review all of these resources yourself. And as we mentioned earlier, we encourage you to share your questions and your comments about this webinar on the NASP member exchange. You can get some advice from other school psychologists around the country. We encourage you to join us for some more Return to School special series webinars that will be addressing multi-tiered systems of support for mental and behavioral health. Those will be following this webinar very shortly. And again, I want to thank Christina Conolly and Amanda Fitzgerald and Eric Rossen for your time and your expertise that you've shared with us today. And thank all of you for listening to this webinar, and thank you for being a NASP member. And please stay safe and healthy in the days ahead.